Hi everyone, I'm Lucie Walters and I'm a rural doctor in Mount Gambier in Australia. Today I want to talk to you about the impact of interpersonal relationships on rural doctors' clinical courage. Firstly, I'd like to acknowledge Ian Cooper, Ruth Stewart, David Campbell and Jill Conkin, my co-researchers in this paper. So clinical courage occurs when rural doctors push themselves to the limits of their scope of practice to provide medical care needed by patients in their own communities. This mental strength to venture, persevere and act out of concern for one's patients despite a lack of formally recognised expertise becomes necessary for doctors who work in relative professional isolation. This occurs with deliberate regard to the resources available and the risks associated with action and inaction. In our previous research, we described rural doctors' lived experience of clinical courage. Now, in this paper, we explore more in depth how relationships with others can impact on clinical courage. From the 27 interviews of rural doctors from around the world, several important themes emerged. Firstly, the underlying relationships with community create the foundation for clinical courage. Patient circumstances influence how we enact clinical courage in our clinical decisions. Local team relationships underpin clinical courage. And the discourse with our peers, other rural doctors, is important in ensuring that we have clear understanding of the clinical courage and its impact. We have a role in supporting less experienced rural doctors in the development of their clinical courage. And many of our metropolitan medical colleagues can facilitate clinical courage, particularly if they understand the context in which we work. However, there are other relationships that can challenge our rural doctors' ways of working. In this article, we conclude that as a collective of rural doctors, we can learn, utilise and strengthen clinical courage and support its development in new members of the discipline. Relationships with our rural communities, rural patients and our urban colleagues can support clinical courage in our rural doctors. And when detractors challenge the value of clinical courage, it requires individual rural doctors and their broader community of practice to champion our way of working. I hope you enjoyed the journal article. Thanks very much.